Hello there and welcome to the Melbourne Catholic website. Lovely to have your company again, and I'm with Paul O'Callaghan. Paul's the CEO of Caritas Australia, and he's here for a very, very good reason. Firstly, welcome, Paul.
Thanks, Shane.
Nice to have you here in, as we're recording today, rainy Melbourne. Let's hope that changes. You've been around the world of recent times for a very important reason, and that is, as you've explained it to me, there is one heck of a crisis confronting us, basically on our doorstep, and at the moment, none of the Western world really knows about it. So can you explain?
Yeah, Shane, it's an unusual thing in the sense that in Eastern Africa at the moment, as a result mainly of a lack of rainfall over the last several years, there's been prolonged droughts. Now, Australians know a lot about drought, something we're very familiar with.
Yeah.
The area that we're talking about is just on the other side of the Indian Ocean from Australia. There are 7 countries impacted, and the reason it's an unusual story in a way is that the scale of the food crisis is so large. There are currently about 23 million people, about the population of Australia, who are on the brink of starvation. And so it does seem a bit odd. We read about all sorts of things with the United States president and the French elections and everything else in the news cycle, but this is a real drama that's unfolding not all that far from us. And of course the Catholic community in Australia for many decades has been very supportive of people in East Africa.
I think a lot of people will be hearing this, and words like Ethiopia and places like that, Mozambique, will be coming into their minds as having had over a 20 or 30 year period their times of disaster. What countries are we specifically referring to this time?
So here we're talking particularly about, well, I was just in Kenya last week, which has about 3 million people in this very extreme food crisis situation. Then you have South Sudan, the country just above that. South Sudan's a brand new country, only 5 or 6 years old. It's the newest new country in the world. Then you've got Somalia, you've got Yemen, which is another one with a very substantial population, over 10 million people in the food crisis situation. Malawi is another one. And then in West Africa, you've got Nigeria, which is facing this. So this group of countries have been devastated really by essentially crop failures. And Shane, the thing, if you drive around in Victoria, anywhere in Victoria, you go past farms where crops are growing and they're at the early stage of growing, and that when you come back 6 months later they'll be full grown and either they will have been harvested or they'll be about to be harvested.
Right.
Well, all of the crops that I saw were just grown about this high, very, very low,
and stopped.
And then stopped.
Wow.
And this is like the second season in a row where they've had this, basically every crop. It's an area where people are successful at farming on a small scale. They provide for themselves, they're very diligent, taking care of their families and so on. And many also have livestock. But the problem when you have no rain for a few years is that, and it's the same here, livestock can't survive without forage. The only way to get forage is rainfall. And so you've got basically very few livestock left, basically almost no crops being produced. And the direct result of that in this group of countries is that families are finding it really extremely difficult to just get by.
So we'll talk about what people can do, and I know Caritas is very keen to run quite a big East Africa appeal. We'll come to that. And I know the Catholic Bishops' Conference with our own Archbishop Dennis Hart are very keen to support that. We'll leave that for a minute. You've just been there. Can you try and, in a sense, make this, for the people watching and for me, as realistic as possible in terms of if those crops don't grow, what then happens?
Yeah. Well, I can put it, Shane, in very simple terms. I was in a health clinic just last week in a rural part of eastern Kenya. The community nurse had asked the mothers of about 60 mothers to bring their young children in. They were mostly from babies through to about 4 years old.
Yeah.
And I asked her why that particular group, and she said, well, these are the group of stunted children. And stunted children means that if you think about here in Australia we use these standard graphs of growth in weight and height for children. They have the same thing exactly. And the community nurse showed me that all of these children were substantially below where they should be for their age in weight and height. There was a young girl there being measured. She was 4 years old, but she actually was the height of a kid just turning about 3, very thin, way under the scale. So they are trying to provide through Caritas some food supplements and so on to these very young kids, but many of them will die, of the ones that I saw before the end of this year. And of course, when you meet with some of the families, as I was fortunate to do through our Caritas network, basically the mothers are now changing the pattern of how they're eating. They're now typically eating only one very small family meal every second day. This is a way to try and get through. And they're hoping that something is going to change, something will improve. Now these are people who are, hard-working farming families.
Yes.
They're not used to this situation. So basically, if it continues into next year, if they get no rain in the coming months, which they normally would get, essentially you're going to see well over 1 million children die just in that area before the end of this year. And so that's why I'm saying it's a strange thing when you're coming back to Australia from that area and you think there's no coverage of this in the media. It's not that the journalists aren't good at what they do, but they're interested in other issues. And yet it is an area that Australians have had a connection with. The Catholic community in Australia has had a real connection with East Africa going back to after the Second World War. There have been people from different orders, there have been nurses. In fact, I have an aunt from Melbourne who had done nursing in Kenya back in the 60s and 70s. So there have been all these connections, but we've kind of lost touch a bit with what's happening there. But there are good things, and it's fantastic that Archbishop Dennis Hart has thrown his weight behind this appeal that we're running in every diocese around Australia now. We're just hoping to help as much as we can, mainly providing food, water and medicine. It is an extreme situation, so we're not even looking at trying to do building houses or anything like that we often do elsewhere. At this stage it's like an ambulance situation, really.
Yes.
And we're very fortunate because we have a network in each of those countries which is well established, been there for a very long period through Caritas, local people who know what to do, where to purchase food, where to arrange things, get logistics done. I was very impressed with the people I met, including the bishop in Kitui, which is the diocese in Kenya that I was in. He and his team of about 35 Caritas staff, they know exactly how to get things done in that area with very limited funds, very competent professionally. So we work basically directly in support of them. We don't have to fly people in to do that type of work.
Right.
And I've got a lot of confidence in the way they go about doing that. The only more complicated situation, of course, is in South Sudan and Yemen. There are civil wars going on.
I was going to say, yes,
And
South Sudan.
that adds a whole new dimension. What that means is that there are several million people who've had to flee their own home communities for safety reasons, not to do with food, to do with safety for their kids. And so those people are in an even worse situation. And the bishops in South Sudan have, basically pleaded with the Catholic community around the world to assist them because they are facing a situation where there could well be hundreds of thousands of deaths of children in a relatively short time.
So we're talking in South Sudan and Yemen about displaced people who are about to also hit famine.
Yeah. The famine's already been declared.
It's a double blow.
In South Sudan. Yeah.
Wow.
Famine will be declared in some of these other areas. That's a technical word, famine,
yes,
that's used by the United Nations. It's already been declared in parts of South Sudan and in Yemen. But in the other areas, like where I was in Kenya, I can only say that, having been to many rural areas around Australia, when you go there and you see there are all these crops that have just stopped. And of course they don't have a social safety net like we do in Australia through government. They don't have that kind of situation.
And we think of Kenya and Nigeria, let's say, as pretty civilised countries.
Yeah, that's right.
And this is happening literally on our doorstep.
That's right.
So look, hopefully with our large array of people who enjoy our Melbourne Catholic website, and this message can get way beyond through social media, that people might respond to your cry today, because help is urgently needed.
Yeah.
Can you have a look at the camera and let people know how they can help?
So the easiest way is just in whatever way you can do, go to our website, which is Caritas, caritas.org.au, and you'll see there on the front page there's an appeal, and if you click on that appeal you'll see there's a mechanism whereby you could make a contribution. And all I can say is I'm very hopeful we can make a real contribution to change, to improvement. I've seen it happen in a number of areas already. Even the area that I was in, the mobilisation across the Catholic network has been phenomenal. And this is an area of expertise as well for Caritas Australia. We do humanitarian responses Philippines, in Fiji and many other places.
Yes.
So we also work closely with our American, UK, Irish and other colleagues. So you can be confident that any donations that might be made will be used extremely efficiently. We have close to the lowest administrative costs in Australia for any aid agency.
And that is something people do question these days, so it's good to hear that.
Yep. So I'm hopeful. We can't change the climate, we can't change the civil wars, but I think we can have real impact. I think we can save thousands of lives. We've already been working with 250,000 people in that area. We can do more with our Caritas Confederation partners and our local partners on the ground. Quite a lot can be done over this coming year if we get a bit more support. So
Well, the clock is ticking, folks, and some of the notes I've read from Paul give the view that, if something doesn't happen by June or July, then this is just a disaster on our doorstep. So it's caritas.org.au if you're able to contribute and help. And Paul O'Callaghan, CEO of Caritas, many thanks for joining us today.
thanks so much, Shane.
Nice to see you.
Yep.